Assalamualaikum warahmatullahi wabarakatuh. Today we are conducting an interview from Dr. Izyan Liyana binti Muhammad Helmi from Hospital Tuanku Jaafar Seremban.
So, Doctor, before we start, may we know how many years have you been working in neurology?
I've been working in neurology my second year as consultant neurologist. But before that, I spent 3 years in training as a neurology fellow. So altogether about 5 years, almost 5 years.
Alright, Doctor. Ask you, why did you choose neurology?
Oh, okay. So, um, like a lot of medical students, I also find neurology very difficult when I was in medical school. So I didn't choose neurology per se, but my interest developed over time lah. So as when I was a medical officer and then as a specialist in general medicine, I encountered a lot of neurology cases, and I always find that people get very nervous and very anxious when they manage neurology cases. So I decided that I want to step up and I want to start managing these patients because they are always, because people get very nervous managing neurology cases. And oftentimes these patients are left without proper of management. So I decided that because I want to challenge myself and I decided to go into neurology.
That's very inspiring, Doctor. Moving on, may we know what are the common cases that you encounter every day in your field that people often overlook?
Most of the time in neurology, the most common cases would be things like stroke, headache, and epilepsy. Yeah, sometimes we see in our clinics. Sometimes we see a lot of Parkinson's disease cases. I wouldn't say people overlook neurology cases. People know about all these cases, but people tend to think about neurology as stroke only. Yeah, but there's a lot of cases in neurology, yeah, like autoimmune disease, like multiple sclerosis, like myopathy, myositis, all kind of different myositis, all kind of different autoimmune peripheral neuropathy that people might not think related to neurology per se. So these are just some of the cases that I counted during my practice. Yeah, but obviously the most common will still be stroke. Yeah, the most common case of neurology in hospital settings will always be stroke.
All right, thank you, Doctor.
Thank you, Doctor. So moving on to the next question. Do you have any interesting cases that you've encountered while working in this field?
For me, all the cases of neurological will be interesting. It's hard to just pick one case, yeah, but I would say my interest is probably in movement disorder, yeah, so patients with involuntary uh, movements, yeah, and also patients with functional neurological disorders. Those two is my special area of interest. But if you ask me to pick one or two cases that I've encountered, I can't pick a case. For me, all cases are equally interesting and important to manage.
Okay, thank you, Doctor. But is there any of the cases that particularly touch your heart?
Well, recently I have a patient who I think he was about 50 in his 50s, who developed rapid cognitive decline, yeah, rapid memory loss. And he had a incidental finding on his chest x-ray, shows lung nodule, lung mass on the chest x-ray. So at the moment, I immediately thought of autoimmune encephalitis, yeah, something that most people don't think of. So we sent his antibody, and true enough, his antibody come back positive, and he has what we call paraneoplastic autoimmune encephalitis, which it's a rare presentation, but it can happen in patients with underlying lung malignancy. They can have concurrent autoimmune encephalitis. So at first, everybody was very hesitant about treating his cancer because his cognition was very bad. But we managed to give him some treatment, with metoprenisolone and plasma exchange, and his cognition immediately improved after 1 week and a half. So everybody, the respiratory team and the oncology team was very shocked when they see how much he's improved. So these are one of the cases that I think people are not aware of, that you can get paraneoplastic encephalitis. Depending on the different types, they can be very responsive to treatment. So we shouldn't give up on them.
Talking about such cases, how do you tell your patients that they are facing such major some sickness or diseases that
Well, this particular case, she's managed with different teams, not just my team, managed respiratory and oncology. So the bad news of the malignancy was not given by me, but in terms of breaking bad news, you have to create a rapport with the family, with the patient first, and then you have to be realistic in your prognosis, but also you have to be compassionate when you're breaking news, because for you it's just another patient, but for them, their family, this is personal. So you also have to give it a bit of a personal touch. For me, I always give bad news in small pieces. I don't break the bad go. So I always do it over time. So it gives people a chance to process.
Understood. Thank you, Doctor.
Thank you, Doctor. So we have the last question for you. So do you recommend neurology to aspiring doctor, and what?
I wouldn't say I encourage people to join neurology. I would encourage people to join what you like and be flexible. When you first started in medicine, you probably have this perception of neurology is hard, or this is hard, this is not what I want to do. But your interest will change. Your commitment will change. So be flexible and don't be afraid to go into something just because you think it's hard. I would say that.
Thank you so much, Doctor, for your time. Thank you so much for joining us in this evening.
Thank you, Doctor.
Okay, best of luck to everybody.
Thank you.
Thank you, Doctor.
Thank you, Doctor.